I mean, in terms of how information is used, in technical terms, you call it as a data, but from a user perspective, we use it as information. I mean, because a lot of information is there in front of our eyes in terms of the lab reports, in terms of the vitals and the monitors. But what is missing is how this data is actually used. I think that is one aspect has to be crystallized. But the second aspect of the data use, I mean, I don't think there will be any second opinion as to the use of this data in the future as we go forward. Especially when we have the real world data of large number of patients, not just few patients that we are managing. As a clinician, I mean, when we use our judgment, the standard of care, we base our standard of care on some of the evidence-based trials and some of the strictly controlled variables. But in the real world, when we actually practice our medicine, a lot of other variables come into picture. So that's where I think in the future, the real world observatory data accumulating from multiple patients, multiple data points, we'll be able to narrow down the standard deviation from the mean as the data gets accumulated. So when you have those dynamic information on a real world practice level, you will be able to actually fine tune and individualize the treatment learnings from this data. So that's, I think, one important aspect of it. To plan your treatment as per the evidence which is getting generated live. The second element of the artificial intelligence, I mean, if you look at the clinicians' population, not everybody has the same level of cognitive skills. Somebody may require enormous data to come to the same conclusion, the diagnostic conclusion or the therapeutic plan. But when you have a technology enablement which assists the clinicians to arrive at the same conclusion as the best clinician. So why should the patient have that uncertainty of the best clinician versus the worst clinician in terms of the cognitive skills? That's where I said the democratization of the cognitive skills. I mean, suppose every clinician is able to get what the best clinician can arrive at a diagnosis or able to apply his learnings from the evidence-based research into the actual planning of the treatment. So that I think that's where the AI is going to come in terms of the clinical decision support based on the real world data and accurate analysis. The third role of AI is going to be in terms of reaching out to the inaccessible areas. I mean, unlike the developed world, the rest of the world has a lot of inaccessible areas where you may not get the expert radiologist or expert pathologist, you may not have enough ophthalmologists. So that's where the technology will be able to enable that even in the inaccessible areas, you may be able to get the expert opinion. For example, if you don't have anything, even the PCR testing in the beginning, and somebody is able to analyze just based on the x-rays and some of the basic CT scans, that you may be likely to have the COVID. So that's a tremendous use of the data. The fourth thing that I can foresee is in terms of now that the COVID is going on, in terms of how this health system resilience of the pandemic preparedness, just from the data of suppose there is a sudden spike in the use of paracetamol, a sudden spike in the use of antiviral drug, or there is a consumption of a particular diagnostic test, you will be able to pick up the early onset of a possible epidemic spike in a particular geography. The technology permits such a prediction of that. And we have witnessed the use of the data, especially say in countries like China, I mean, where they have total control on the technology, irrespective of the privacy and other things. So you have been still able to use that technology, power of technology for the good of the population. It may be used for the bad of the population as well, but at least we have a demonstration, clear-cut demonstration of good of the population. So this is, I think we can go on listing out multiple things, including how you can regulate, say, infusions in the home ICU setting through the IoT with a trained nurse at the bedside. But you, as a critical care specialist, you can actually titrate the supports in a remote fashion, which was not possible without this, the new age technology.